Your kidneys failed you long before you knew they were failing. That is the most important sentence in this entire video. Read it again. Your kidneys failed you long before you knew they were failing. Because that is precisely how kidney disease works in the majority of people over 50. Not dramatically, not painfully, not in any way that announces itself clearly enough to make you pick up the phone and call your doctor. Quietly, slowly, over months and years, while you attributed every single sign to something else entirely. The medical community has a name for this. They call chronic kidney disease the silent killer. And that name is not an exaggeration. According to the National Kidney Foundation, 90% of people with chronic kidney disease do not know they have it. 90%. That is not a small oversight. That is a systemic failure to connect symptoms that are hiding in plain sight to the organ that is causing them. I have sat across from patients who had been living with significantly reduced kidney function for 2, 3, sometimes 4 years before we identified what was happening. And when I walked them through the signs that had been present the entire time, the response was always the same. A long pause. Then, I thought that was just getting older. That phrase, that single phrase. I thought it was just getting older. It has cost more people more years of healthy life than almost any other explanation I have heard in over 2 decades of practice. My name is Dr. Jonathan Reeves. I specialize in internal medicine with a focus on kidney health in older adults. And I am making this video today because the 8 signs I am about to walk you through are real, documented, clinically recognized warning signals that your kidneys are struggling. Every single one of them is routinely dismissed by people over 50 as normal aging. Every single one of them deserves a completely different response. Stay with me through all 8. Sign number 3 is the one that makes patients go completely silent when they hear it. And sign number 7 is the one that almost nobody connects to kidney health, even though the research connecting them is overwhelming and has been available for years. Let us start right now. First, understand why your kidneys cannot afford to wait. Before we get into the 8 signs, I need you to understand one thing about kidney disease that changes how seriously you take everything else in this video. Your kidneys do not regenerate. Your liver can regenerate. Your skin regenerates constantly. Even your heart muscle has limited regenerative capacity. But your kidneys contain approximately 1 million tiny filtering units called nephrons. And when those nephrons are damaged and lost, they are gone permanently. Your kidneys compensate by working the remaining nephrons harder, which is exactly why kidney disease is silent for so long. The remaining nephrons pick up the slack. Blood tests can appear relatively normal. You feel functional, life continues, but compensation has a limit. And by the time most people discover their kidneys are failing, they have often already lost 50, 60, sometimes 70% of their kidney function. The damage done in silence over years cannot be undone. Early detection changes everything. Kidney disease caught at stage 2 or 3 is manageable. It can be slowed dramatically, in some cases, stabilized almost completely. Kidney disease caught at stage 4 or 5 means dialysis conversations, transplant discussions, a fundamentally different life. The difference between those 2 outcomes is often nothing more than recognizing the signs earlier. The 8 signs you are about to hear. Sign number 1, you are more tired than you have any reason to be. Robert was 67 years old. He came to me for what he described as the most frustrating symptom of his life, fatigue that made no sense. He was sleeping 8 hours. He had retired 2 years earlier, so he was not overworked. He had no depression. He had no obvious reason to be exhausted by early afternoon every single day. His previous doctor had checked his thyroid, normal, checked his iron, normal, suggested he might be slightly depressed and offered medication. Robert declined and came to me instead. We checked his kidney function. His GFR, the measure of how well his kidneys filter blood, was 42. Normal is above 90. Robert had been walking around with less than half his kidney function for an estimated 18 months, feeling exhausted, and nobody had connected the 2. Here is the mechanism that most people never hear explained. Healthy kidneys produce a hormone called erythropoietin. Erythropoietin signals your bone marrow to produce red blood cells. Red blood cells carry oxygen to every tissue in your body. When your kidneys are damaged and their hormone production drops, your bone marrow receives a weaker signal. Fewer red blood cells are produced. Less oxygen reaches your muscles, your brain, your organs. The result is a specific type of fatigue called renal anemia that feels different from ordinary tiredness. It is not the tiredness that sleep fixes. It is a heaviness, a deep, bone-level exhaustion that persists regardless of how much rest you get. The kind of fatigue where climbing one flight of stairs feels like an unreasonable demand, where the energy to do things you used to enjoy simply is not there anymore, and you cannot explain why. This fatigue is not aging. It is your kidneys telling you something is wrong with their ability to support the rest of your body. What to do this week? If you have persistent, unexplained fatigue that sleep does not resolve, ask your doctor specifically for a comprehensive metabolic panel that includes creatinine and a calculated GFR. Ask also for a complete blood count to check for anemia. These two tests together will tell you a great deal about whether your kidneys are involved in your exhaustion. Do not accept "you're just getting older" without these numbers in front of you. Sign number 2. Your urine has changed and you have not said a word about it. This sign is the one people are most reluctant to discuss. In 22 years of practice, I have consistently found that patients notice changes in their urine and say nothing about them for months, sometimes years, because it feels like an embarrassing topic, because they assume it is not serious, because they have normalized something their body is doing everything it can to make them notice. Your kidneys filter approximately 200 liters of blood every single day. The waste products they remove leave your body as urine. When kidney function is compromised, the filtration process breaks down in specific ways that show up directly in what you see in the toilet. Foamy or bubbly urine that persists and does not dissipate quickly is one of the most important visual signs of kidney dysfunction available to you without any medical equipment whatsoever. Persistent foam indicates protein in the urine, a condition called proteinuria. Healthy kidneys retain protein in the bloodstream. Damaged kidneys allow protein to pass through into the urine. The foam you see is the same physical phenomenon you see when proteins are agitated in any liquid. Your body is literally showing you that its filtration barrier has been breached. Changes in urination frequency also matter significantly. Needing to urinate more frequently, particularly at night, is called nocturia and is one of the earliest functional signs of declining kidney efficiency. Conversely, producing less urine than normal, or urine that is darker and more concentrated than usual, can indicate the kidneys are struggling to process adequate fluid volume. Blood in the urine, even a faint pinkish tinge, even once, is never something to monitor and see if it goes away. It requires immediate medical attention. What to do starting today? Pay attention to your urine for 1 week in a way you have never paid attention before. Note the color, the clarity, whether there is foam, and whether the frequency has changed compared to what was normal for you a year or two ago. This sounds simple because it is simple, and yet it provides genuinely valuable clinical information. If you see persistent foam, tell your doctor immediately and ask for a urine albumin to creatinine ratio test. That test can detect kidney protein leakage with high precision. Sign number 3, your face is swollen when you wake up. This is the one that stops people. Because puffiness around the eyes and face in the morning is so commonly attributed to sleeping position, allergies, aging, salty food the night before, that almost nobody connects it to their kidneys. But there is a specific pattern of facial and periorbital swelling, meaning swelling around the eyes, that is a well-documented early sign of nephrotic syndrome and protein loss through damaged kidneys. Here is what is happening. When your kidneys lose protein through damaged filtration membranes, the protein level in your blood drops. Protein in your blood, particularly albumin, is what keeps fluid inside your blood vessels through a process called oncotic pressure. Think of it like this. Your blood vessels are tubes with slightly permeable walls. The protein inside those tubes acts like a sponge, holding fluid in through osmotic attraction. When protein leaks out through damaged kidneys, the sponge effect disappears. Fluid that should stay inside your blood vessels seeps out into surrounding tissue. And where does that fluid go first? It goes to the most compliant, loosest tissue in your body, the tissue around your eyes. When you lie flat overnight, that fluid settles around your face. You wake up with puffy eyes, a swollen face, a fullness that you have been blaming on your pillow or your sinuses. This facial swelling is clinically distinct from allergy-related puffiness. Allergy puffiness is accompanied by itching, redness, congestion. Kidney-related facial swelling is not. It is quiet swelling, symmetrical, worse in the morning and improving throughout the day as gravity pulls the fluid downward. By evening, your face looks normal, and you have forgotten it happened again. I have had patients who described this symptom for 2 years before anyone considered their kidneys as the source. 2 years of kidney damage progressing silently, while the swelling was blamed on everything else. What to do tomorrow morning. Before you look in the mirror, before you splash water on your face, take a photograph. Then compare it to photographs from 1 and 2 years ago. Not selfies necessarily, just any clear photo of your face. If you see a consistent change in puffiness around the eyes that is present in recent photos but absent in older ones, that visual evidence is worth bringing to your doctor explicitly. Ask for a serum albumin level and a urine protein test. Sign number 4. You have persistent itching with no rash. You have itching, not in one spot, not from a rash you can see, itching that moves, itching that is worse at night, itching that no lotion, no antihistamine, no change in soap or detergent has resolved, itching that has been going on for weeks or months while you have tried everything you can think of to make it stop. This specific type of itching has a medical name, uremic pruritus, and it is caused by one thing: the accumulation of waste products in your bloodstream that healthy kidneys would have already removed. When kidney function declines, waste products that should be filtered and excreted begin building up in your blood. Urea, phosphate, and other metabolic byproducts accumulate in tissues throughout the body, including the skin. These accumulated compounds trigger nerve endings in the skin in a way that registers as itching. There is no rash because the trigger is coming from inside the tissue, not from the surface. No external treatment will resolve it because the source is internal. The itching of uremic pruritus tends to be worst at night when the body's natural cortisol levels are lower and inflammatory responses are less suppressed. It can affect any part of the body, but is frequently reported on the back, arms, and legs. It is relentless, it is exhausting, and it is almost universally dismissed as a skin condition by everyone, including many physicians who see it without considering the kidneys. A landmark analysis published in the Journal of the American Society of Nephrology found that uremic pruritus affects between 40 and 50% of patients with moderate to advanced chronic kidney disease and is one of the most consistently underreported symptoms in nephrology practice. What to do right now? If you have persistent itching without a visible rash that has lasted more than 3 weeks and has not responded to any topical treatment, write down exactly when it started, where on your body it occurs, and what time of day it is worst. Bring that description to your doctor and ask specifically, could this itching be related to kidney function? I'd like my creatinine and BUN checked. BUN stands for blood urea nitrogen. It is a direct measure of waste product accumulation in your blood. Sign number 5. Your breath has a strange metallic or ammonia taste. Patricia came to me convinced she had a dental problem. She had seen her dentist twice in 3 months. Her teeth were fine, her gums were fine. There was no infection, no abscess, nothing that explained the strange metallic taste in her mouth that had started several months earlier. Her dentist told her it was probably dry mouth or a medication side effect. She changed her medication. The taste remained. Patricia had stage 3 chronic kidney disease. When kidneys are not filtering waste efficiently, urea accumulates in the bloodstream. Urea is then converted by bacteria in the mouth and digestive tract into ammonia. That ammonia has a distinctive smell and taste. Patients describe it variously as metallic, like copper or old pennies, or as ammonia-like, reminiscent of cleaning products, or as a general sense that food does not taste right anymore, that things taste different than they used to, that there is an underlying flavor they cannot identify or remove. This symptom, called uremic fever, is not subtle once you know what you are looking for, but without that knowledge, it is incredibly easy to attribute to dental issues, to medications, to dietary changes, to the general changes in taste perception that do occur with aging. The difference is that age-related taste changes are gradual, affect all flavors relatively equally, and do not have that specific chemical or metallic quality. Uremic taste is distinctive. It has a particular character, and once patients understand what they are looking for, they recognize it immediately. What to do today? Think honestly about whether food has tasted different over the past several months. Think about whether there is any underlying taste that seems chemical, metallic, or ammonia-like that is present even when you are not eating or drinking. If the answer is yes, and especially if you have any of the other signs we have discussed, kidney function testing needs to happen soon. Not at your next annual physical, soon. Sign number 6. You cannot concentrate, and your memory has gotten noticeably worse. This is the sign I promised you would surprise people, because when someone over 50 experiences memory problems or difficulty concentrating, The word that immediately comes to mind is dementia, and that fear is understandable. But it causes millions of people to accept cognitive changes as an inevitable march toward Alzheimer's, when what is actually happening is something far more treatable. Kidney dysfunction affects brain function directly and measurably. When waste products accumulate in the bloodstream because the kidneys are not clearing them efficiently, those compounds cross into the brain. They impair neurotransmitter function. They create inflammation in brain tissue. They disrupt the electrochemical environment that neurons need to fire properly. The result is called uremic encephalopathy in its severe form, but in its early mild form, it looks exactly like what millions of older adults experience every day. Difficulty finding words, trouble concentrating on tasks that used to be easy, a mental fogginess that is worst in the afternoon, short-term memory that feels like it has developed small but frustrating holes. Additionally, the same renal anemia we discussed in sign number 1, the reduced production of red blood cells caused by declining erythropoietin, reduces oxygen delivery to the brain directly. Your brain consumes 20% of your body's total oxygen supply. Even a modest reduction in that supply impairs cognitive performance noticeably. Research published in the Clinical Journal of the American Society of Nephrology found that cognitive impairment is present in a measurable and clinically significant proportion of patients with moderate chronic kidney disease, and that the impairment improves meaningfully when kidney function is stabilized and anemia is treated. Read that carefully. The cognitive impairment improves when the kidney problem is addressed. This is not dementia. This is a kidney problem wearing a dementia mask. And the difference between those two diagnoses is the difference between manageable and irreversible. What to do before your next appointment. If you have experienced noticeable cognitive changes over the past 1 to 2 years, do not accept a diagnosis of age-related cognitive decline until kidney function has been explicitly ruled out as a contributing factor. Ask your doctor directly. Has my kidney function been checked recently, and could it be contributing to my cognitive symptoms? That question deserves a direct answer with numbers attached to it. Sign number 7. Your lower back hurts in a way that is different from muscle pain. Back pain in adults over 50 is so common that it has essentially become invisible. Almost everyone has it. Almost everyone attributes it to arthritis, to an old injury, to sleeping in an awkward position, to the general structural wear that accumulates over decades of living in a human body. And most of the time, that attribution is correct. But there is a specific quality of kidney-related back pain that distinguishes it from musculoskeletal pain when you know what to look for. And knowing what to look for could be the difference between treating back pain and discovering a kidney problem before it progresses further. Kidney pain is felt in the flank, the area between the lower ribs and the hip on either side of the spine. It is typically a dull, deep ache rather than the sharp, movement-related pain of a muscle problem. It is not made worse by specific movements, the way muscular back pain is. It does not improve with stretching, heat, or the anti-inflammatory medications that typically ease musculoskeletal discomfort. And it is frequently accompanied by one or more of the urinary changes we discussed in sign number 2. Kidney pain can also present as a pressure sensation rather than a traditional ache. Patients describe feeling as though something is sitting heavily on one or both sides of their lower back, a fullness that has no positional explanation. The causes of kidney-originating back pain in older adults include kidney stones, kidney infections, kidney cysts, which become increasingly common with age, and the general inflammatory response associated with nephron loss and declining kidney function. The critical clinical point is this. Kidney-related back pain does not respond to the treatments that help musculoskeletal back pain. If your back pain has not responded to weeks of physical therapy, stretching, heat, and standard anti-inflammatory treatment, and if it sits in that specific flank location rather than across the lower back generally, kidney evaluation needs to be part of the diagnostic conversation. What to do this week? Map your pain precisely. Use your hand to identify exactly where the discomfort is. Is it across the lower back symmetrically, which suggests muscle or disc involvement, or is it specifically on one or both sides, between the last rib and the hip, which is the anatomical location of the kidneys? That distinction, described precisely to your doctor, changes the entire direction of their diagnostic thinking. Sign number 8. Your ankles and feet swell every single evening. I want to finish with this one because it is the most visually obvious sign on this entire list, and yet it is the sign most consistently explained away by the people experiencing it. My ankles swell because I'm on my feet all day. My feet swell when it's hot outside. I've always had circulation problems in my legs. My mother had the same thing. It's just how our family is. I have heard every version of this explanation, and for some people, in some contexts, these explanations have some validity. Temporary ankle swelling from prolonged standing or heat is a real phenomenon, but there is a critical distinction that changes everything. Kidney-related ankle and foot swelling follows a very specific pattern. It is essentially absent in the morning after a night of lying flat. It builds progressively throughout the day. By evening it is most pronounced. It is bilateral, meaning both ankles and feet equally, not one leg significantly more than the other, which would suggest a venous problem in that specific leg. It leaves sock marks that persist for 30 minutes or more after the socks are removed. And it is present day after day, week after week, in a pattern that does not have good days and bad days, but rather a relentless consistency. This pattern reflects exactly what is happening physiologically. Your kidneys, struggling to regulate fluid and electrolyte balance, are allowing excess sodium and water to remain in your system. Gravity pulls that excess fluid to the lowest point of your body during the day. By evening, your ankles carry the visible result. This is not a leg problem. This is a kidney problem expressing itself in your legs. And here is what makes this particularly urgent. Sodium and water retention caused by kidney dysfunction also raises blood pressure. Elevated blood pressure damages kidney tissue further. Damaged kidneys retain more sodium. Blood pressure rises higher. It is a self-reinforcing cycle that accelerates kidney decline, while the primary symptom, swollen ankles, continues to be blamed on how much time you spent on your feet today. What to do tonight? After you remove your socks this evening, press your thumb into the top of your foot for 5 seconds. Release and watch. If the indentation remains visible for more than 2 to 3 seconds, you have pitting edema. Photograph both feet and ankles at the same time every evening for 1 week. That documentation demonstrates the consistency and pattern that is clinically meaningful. Bring those photographs to your doctor, along with a request for kidney function testing. Here is what I need you to take from this conversation. 8 signs. Persistent, unexplained fatigue. Changes in your urine including foam and frequency. Morning facial swelling around the eyes. Itching without a rash. A metallic or ammonia taste in your mouth. Cognitive changes including memory and concentration difficulties. Flank pain that does not respond to standard back pain treatment, and consistent evening ankle and foot swelling. Not one of these signs is dramatic. Not one of them announces itself the way a heart attack announces itself. Every single one of them whispers, and every single one of them has a completely reasonable-sounding alternative explanation that most people, and tragically many doctors in a 15-minute appointment, will accept without looking further. You no longer have to accept that. The kidney function test you need is not expensive. It is not invasive. It is a blood test called a comprehensive metabolic panel that measures creatinine and calculates your GFR. It is a urine test called a urine albumin to creatinine ratio. These two tests, together, provide a clear, accurate picture of how your kidneys are functioning right now. They are covered by Medicare for most people reading this. They can be ordered at any routine appointment. What they require is you walking into that appointment and saying these words: I want my kidney function checked specifically. I want my GFR and a urine albumin to creatinine ratio. I have been experiencing symptoms that concern me, and I want numbers, not reassurance. That is all it takes. Numbers. Real numbers. Not everything looks fine. Numbers that tell you where your kidney function actually stands, so that if something is happening, you find it now, not 2 years from now when the options have narrowed significantly. Your kidneys have been filtering your blood every minute of every day of your entire life. They have never complained. They have never demanded attention. They have quietly done one of the most essential jobs in your body with zero recognition. They are asking for your attention now, through these 8 signs, through the whispers your body has been sending while you attributed them to age, to weather, to diet, to everything except the organ that was actually struggling. Listen now. While listening still makes a difference, share this video today with someone you care about, someone who has been dismissing these signs. Someone who deserves to know what their body is actually telling them before it is too late to do something meaningful about it. Subscribe to this channel. Every week I bring you the conversations that should be happening in doctors' offices, but aren't. Honest, evidence-based, and built entirely around keeping you informed, independent, and in control of your health. I will see you in the next one. Your kidneys are worth fighting for. Start that fight today.